Welcome to the Turtleshell Therapy Institute, a podcast made to help you learn how to feel more comfortable inside and outside of your shell. Hello, and welcome to the Turtleshell Therapy Institute. I'm your host, Jim Smyth-Dent. Today, we're joined by Kelly Smyth-Dent. Kelly is a licensed clinical social worker and an EMDR-approved EMDR consultant, therapist, and trainer. Kelly specializes in working with immigrants and refugees and provides EMDR intensives. She's the founder of Scaling Up, where Kelly offers trainings on EMDR and EMDR protocols to clinicians, as well as consultation for EMDR therapists. Kelly is with us today to discuss her work and services she provides, explain EMDR, and why therapists should consider getting trained, as well as what people can look for in a potential EMDR therapist. Kelly, welcome to the show. So happy to have you here.
Thank you. It's great to be here. Thanks for the invitation.
Oh, of course. Well, the first question I'd like to ask, if you could just kind of tell us a little bit about what is Scaling Up, what services do you offer there, how'd you get it started?
Yeah, so before I became a therapist, I worked in refugee resettlement, which is why I have history working with immigrant refugee populations. And during that time, I realized that a lot of the refugees that were coming to the States were physically free, but emotionally very much still in bondage, and providing services was difficult because of financial purposes, because of stigma, language, culture, all of that. So some cities have great refugee resettlement mental health programs, but the cities I was working in at the time did not. And so when I got into the mental health world, I was very focused on the idea of making mental health services more accessible and affordable to people. And during my training, I learned about EMDR therapy, and specifically how to do EMDR in a group setting, which really appealed to me because that felt like a much better option for refugee cultures because it's more collective, it's more communal. You could have one interpreter for a large group of people. You could serve more people, faster, more effectively. And so I connected with Dr. Nacho Herrero, who was the original creator of the group EMDR protocol, and also created Scaling Up in order to help make EMDR services specifically more accessible and affordable to people.
Oh, wow. What a cool journey.
Yeah, it's been a wild ride. And I started Scaling Up, I guess it's been about 5, almost 6 years ago now.
Okay.
And it started with Dr. Herrero and I working closely together, providing trainings and doing some humanitarian work. And then it's sort of evolved into a bigger training program where we offer EMDR basic training, we offer group protocol training, acute stress training, we offer CEs for therapists, we still do humanitarian work in association with it, EMDR refresher courses. So we've kind of expanded. It's still very much trauma and EMDR focused and humanitarian focused, but we offer scholarship programs and sliding scale fees and different payment structures and things like that to try to make it more accessible to therapists. Mm-hmm. And then we also provide communities to try to help therapists kind of think outside of the box as far as how they want to provide services. Sometimes people want to sort of get outside of the therapy room, and they want to see clients in the therapy room, but they also want to respond to disasters in their community or around the globe, or, kind of align with our mission a little bit. And so we provide a community and support to help make that happen for like-minded therapists.
Very cool.
Yeah.
What a needed resource.
Yeah, it's been a ton of fun too. I mean, also just connecting with like-minded people that have similar interests and trainings, and kind of helping to empower them to provide those services in the way that makes sense for their community or the populations that they work with, because it's not really one size fits all. And I think there's a lot of different ways in which you can experience healing. EMDR is one of them, and different methods in which you can provide EMDR. It can vary depending on lots of different aspects of the situation.
Oh, totally. And that's where I think, one of my first or second episode, I can't remember. I did do like a really brief, minute or two spiel on EMDR and kind of
Huh?
explain the 8 phases. But yeah, just the way it can be used for so much more than what people think. But if you wouldn't mind just explaining just a little bit to the listeners, what is eye movement desensitization and reprocessing therapy?
Yeah, so EMDR is an evidence-based therapy that's mainly known for providing treatment for PTSD, but the research over time has shown that it can really expand to different issues like depression and anxiety. And ultimately, the way that I like to describe how EMDR works is you're taking or the idea is that clients typically come to you because they have symptoms that are bothering them, depression, anxiety, PTSD symptoms, something like that. Or they have an experience that kind of has stuck with them that really bothers them still today, that they feel like they can't just like let go of or release. And EMDR can kind of target both of those areas and help reduce any activation or distress that are linked to those symptoms or experiences, because the idea or the theory behind EMDR is that those symptoms don't just appear for no reason, that they're linked to an experience that has happened either recently in that person's life or maybe 50 years ago or something back in childhood that just hasn't quite resolved. And so EMDR will target those specific experiences to reduce the activation down to sort of a neutral place, meaning you're not necessarily not going to feel sad about a tragic experience that's happened, but it's not going to have the same level of activation. It doesn't kind of piss you off in the same way or get your blood boiling or whatever in the same way when you think back about that memory. It's kind of sort of becomes this sort of like, that's a sad memory, or that's an unfortunate thing that happened. This is how it's impacted me. Now moving on. And so then those symptoms, the depression, the anxiety, the PTSD symptoms that are linked to those experiences also reduce or eliminate altogether, which is usually the person's goal for coming to therapy, is they want those symptoms to go away.
Oh, yeah, thank you. That's a really good explanation of it too. And because I know that's something I struggle with still as an EMDR clinician, explaining it in a way that makes sense to people.
Yeah, I mean, the idea is that your body and your brain naturally want to heal and have the ability to heal. So just because you experience something traumatic doesn't mean that you're going to develop PTSD. So for example, you and I could get in a car accident together. You might walk away from the car accident and be totally fine, like, whew, close call, moving on. And maybe I have panic attacks now when I get in the car.
Yeah.
And that could be for a variety of reasons. There could be components of that memory, like I just can't get the image of the car coming at me out of my head, or the sound of the screeching tires or something like that. And so it's developing, it's creating this panic-like sensation attached to that experience. And that could have just developed organically as kind of a one-off experience, or maybe I'm having that reaction because it made me feel like I was going to die. And maybe I have an experience from my past where I almost died or felt like I was going to die. And so it's kind of accumulated over time and sort of exacerbated that new recent experience, and has now exacerbated the symptoms that are linked to it as well. And so the idea is that the brain actually has the ability to naturally, organically reprocess that memory. And for a lot of people that does happen. You might have some symptoms of acute stress initially, but then your brain actually sorts it out over time, especially if you're able to sleep or have supportive people around you or a stable environment, that you go home to at the end of the day. Sometimes it can just dissipate over time naturally, but for some people that doesn't happen. And that's where EMDR can help come in and help your brain sort that through. Kind of like if you had a cut on your arm, you kind of need to wash it out, take care of it, keep it dry, bandage it, keep it clean, and your body will naturally, typically heal that. But if you don't take care of it, then it may not heal on its own. It might get infected and need more help. And so that's kind of the same concept as, your brain might need a little bit more help getting those stuck pieces unstuck. And that's where EMDR can come in.
And I like that a lot too, because thinking of the mind like any other part of the body, it's always going to try and heal. And some people just need more assistance with the cleaning and keeping the wound.
Yeah, and it
So,
doesn't mean they did
yeah.
anything wrong. It's literally just how their brain is working and functioning, or how their body absorbed that particular experience. It's not that they've done anything wrong. It's just how, the same way that, certain things in our body heal certain ways, or injuries or whatever that we get. It's not that we've done anything wrong. It's just that's what happened, and that's what our body needs, and it's pretty simple. So now let's go give the brain what it needs to get unstuck.
Oh. Well, I am curious too. So, no, thank you for that, for explaining EMDR. So, I would love to hear more about, because I took the training back in 2017, actually. I know that's how you and I had first kind of met, but not really.
The basic training?
It was the early intervention protocol.
Oh, nice. Okay, cool.
Yeah, with you and Dr. Guerrero. Yeah. Yeah. So is that the protocol you mostly use when you do group for humanitarian work? Okay.
Mm-hmm.
Yeah. Would you mind explaining?
Sure. So in Nacho's training, it's a training on EMDR for early intervention and ongoing traumatic stress. So for situations where it's a recent event, where it's still ongoing today, or even prolonged adverse experiences. So maybe, for example, prolonged adverse experience would be maybe the client experienced sexual abuse from ages 6 to 12, but now they're 50 and they're not experiencing it anymore, but they have a lot of experiences during that 6-year period. Instead of targeting each of those experiences individually with the standard protocol, which could take a long time, it allows you to target that entire 6-year period with the Pressy protocol, which is an adaptation of the standard protocol. It's still EMDR, but it just allows you to conceptualize the situation differently and focus on it differently in a way that is really effective and can work a little bit faster than individually targeting each of them. Same with ongoing traumatic stress. So sometimes, let's say like a first responder experiences vicarious trauma, and then they still have to show back up to work. And so their system never really gets that safety period, that opportunity to organically process, because they always have to be alert, because they're going right back into the same situation again.
Okay. Oh. Okay. Yeah. So I remember I've learned about the Pressy a little bit before too. I definitely need to do more studying up on it, but
right. Yeah. So you learn the assist, you learn the Pressy, and you learn IGTP. So the IGTP is the group protocol for EMDR. The Pressy is an individual protocol for EMDR that's adapted, the one I was just explaining. And then the assist, you can learn in both the individual and group format. And the assist is designed for desensitization. So you can use it before EMDR as sort of a preparation. If the client is so activated that they are not ready for EMDR, or they, maybe it's like a 12 out of 10, like they're just so activated, you want to get that activation down to a more manageable level before you do EMDR. Yeah. If they dissociate, things like that, or after a recent event, if you're seeing somebody a day, a week after the event, it might be too premature to do EMDR. So you want to start with stabilization first. Yeah. So that concept of the early intervention, sort of like if you get in a car accident and the paramedics come, the goal of the paramedics is to stabilize the person, to get them to the hospital, to then get the follow-up procedure or the surgery. The assist is kind of like the paramedics. It's just designed to stabilize so that you can then follow up with EMDR to actually do that deeper work. So there's a couple different situations in which you'd use the assist.
That's fascinating. And yeah, I've done a little bit of the training, a little bit on scaling up, but I still need to continue more into it, because I've been interested in EMDR intensives, but part of where I was like, oh yeah, with the clusters of memories, I'm even thinking of my clients with attachment focused EMDR, these repetitive, even small moments that keep happening over and over. Because it'd be really hard to target one memory to even think of one. And it can take a long time if we target every experience.
Exactly. Yeah. So that's where the Pressy could be really helpful with those types of situations.
And so I know you do EMDR intensives too. What do those look like?
So you can do EMDR intensives a variety of different ways. We actually have a training on our website about how to do them, or a couple of ways in which you can do them, but really there's not a one size fits all. So our training teaches people the way that I do it. And then also my colleague, Sadie Smith, the way that she does it, because she does it a little bit differently than me. So you get sort of two different approaches to help you sort of think about how you may want to incorporate it into your practice. Because from what the research shows, EMDR intensives work just as effectively and at the same rate as week-to-week EMDR. You just get it done faster because you're doing it in an intensive format. So for example, when I do intensives, I see somebody from 9 a.m. until 5 p.m., the same person. We take an hour and a half lunch break in the middle of the day, and then whatever other bathroom, coffee breaks kind of organically we want to take throughout the day. And so between talking and breaks, we probably end up doing about 6 hours of actual EMDR therapy throughout that day. So the amount that they can get done in 6 hours is equivalent to, let's say, 6 weeks of weekly 1 hour sessions. So for people who really just want to, jump in and get it done as quickly as possible and have the financial means to do that and the emotional capacity to really sit in the ick throughout the day, because it's kind of, you get the relief as well, but there's a lot of just like sitting in like not fun memories. So if you have the capacity and the desire to do that, intensives are great because you can just get results faster. So it's just another option. You can also do extended sessions. So you can maybe, instead of seeing them for 50 minutes or 60 minutes, you see them for 3 hours a couple times a week or something like that. So you can kind of customize it depending on the desire of the therapist and the desire and needs of the client, and just have that flexibility. The way I do it is supplemental to other types of services that people are experiencing. So for example, a lot of people will be seeing a therapist week to week, and then they'll come to see me to do a 2-day intensive to sort of kickstart some of the progress. And then they'll go back to their weekly therapist to see if they can sort of pick up from that area, because they want to start getting a move on in certain areas that they might feel stuck in or something like that. So there's a lot of ways in which you can use it to supplement what you're already doing with your client or what somebody else is doing with their client.
Oh, that's really cool.
Yeah.
And I'm glad I'm happy how you explain that too. Do you have the emotional capacity as part of that too? Because I see a lot of people do seek out EMDR because they hear it's fast. And what I explain to a lot of people, which I need to do more of the EMDR intensive trainings, but what I explain to a lot of people is that it can be fast, and we want to make sure we're not flooding you or doing too fast. Yeah, pacing it out is really important.
Exactly. Yeah. So I find it tends to be really fast for people who are focusing on one-time experiences, not cumulative trauma or prolonged experiences, or experiences that have happened more in like adulthood or more recent events. But if you're doing like attachment issues or developmental trauma or something, it's probably, or if the person dissociates a lot, those types of experiences are going to take a lot longer to process just because of the nature of the experience. So it is helpful to also give people a sense of what's realistic, because it can work really fast depending on what you're focusing on and what your history is and how stable you are currently and all these other factors.
Totally. So with the mass events, with the group protocol that you were talking about, what does group EMDR look like?
Yeah, group EMDR, it's very cool. So normal standard EMDR is typically, eye movement back and forth, or maybe you're doing butterfly hugs, you're tapping on yourself. There's a variety of ways you can do bilateral stimulation at this point, and dual attention stimulation that we're finding is really effective. There's more research coming out that it doesn't necessarily have to be eye movement specifically for it to be effective. So with the group protocol, we use the butterfly hugs for the bilateral stimulation, which one of my favorite things about that is that the person is in complete control themselves. So you'll find that some people tap really quickly, some people tap really slowly and lightly, some people go for a longer period of time, some people go for a shorter period of time. So as you're watching the group sort of organically do the tapping on themselves, what we're noticing is that people aren't dissociating, And we think that part of the reason for that is because they're organically listening to their bodies and not going outside of their window of tolerance as a result of being in control of that process. So if it gets to be too much, they might slow down naturally or even stop naturally. But if they're really wanting to push through, then maybe they'll go faster or they'll stay in longer. And because they're listening to their bodies, they're going to stay within that window of tolerance. Whereas if the therapist is in control, we can be attuned to our clients, but ultimately we're not inside their bodies. And so we might accidentally kind of push them further than their bodies want them to go. And then they start dissociating, which you can recover from. It's not a big deal. But it does slow down the process. It can be really tiring for the client. And then you'll have to spend some time regrounding and sort of regrouping after that. Whereas, you might be able to avoid that some if the client is tapping on themselves. So with the group protocol, they're tapping on themselves. There has to be a collective trauma experience that you're targeting. So for example, you can't just have 20 people walk in the room, all with all sorts of different experiences, focusing on different things, or else the therapists aren't going to know how to contain the situation because they don't know what people are focusing on. So a collective trauma experience could be like your refugee journey, your first responder experience, your sexual abuse experience, something like that, where everybody's coming in with a common experience. It doesn't have to be the same experience, but you're all focusing on a common experience that you've had. That's why you're there. So you're focusing on that experience. And then we're also using drawing to process. So in EMDR, in an individual session, you'll say, what are you noticing? And the client will tell you what's coming up for them. And instead of talking in the group setting, you're drawing what's coming up for you and you're writing down your SUD. And then there's an emotional protection team that's sort of walking around the room. So if you have a large group of 100 people, you have people walking around the room, making sure people are following the instructions, answering questions, just kind of like glancing at the photos and the SUDs and just making sure everything's looking okay. And so you sort of follow the protocol to the end. And then ideally, usually one set takes about 45 minutes to an hour. Ideally, you want to do about 6 sets on the same target. Because as we know, EMDR takes some time to reprocess. So it's not going to just be processed in one session. And so best practice, what we found is about 6 sets on the same topic. You can do 3 in a day, 2 days in a row and do an intensive format, or you can spread it out over time, depending on what's available to the therapist and the participants.
Okay. And that makes sense too. You all have a shared experience. And then, using the drawing and having them rate. I also just am I hadn't heard that about the butterfly hug too. So I wanted to also mention that too, just that they dissociate less. And I feel like that speaks even more to the body tries to heal and how empowering that is to people to know that like, I can actually trust my body. Because so many people don't trust their instincts, their body, their own natural rhythm.
Exactly. Yeah. And sometimes that's related to the trauma as well. So there could be some complications there, but ultimately our bodies are trying to help us survive and they're trying to keep us regulated and keep us safe. So sometimes it can feel like our body is hijacking us a little bit because we're getting so anxious or dysregulated, but ultimately that's because the body thinks that you're being threatened and is trying to protect you. And so sometimes the wires might get crossed a little bit where the body needs some help knowing, for example, that the fire alarm, if the fire alarm goes off, is the house actually on fire or is there just smoke, or is it just steam? What's happening here? And sometimes the body gets confused too, where it's like, it thinks that there's a fire, but there's actually not. And so EMDR can sort of help the body sort of get reacclimated and balanced. So it makes sense that some people have trouble trusting their bodies for good reason, but ultimately the body is always trying to protect you and keep you safe and alive.
Exactly. And just how cool it can be to be able to have, and I know for some people, groups can be really scary, but to be able to have that, like, okay, there are other people who've had a similar experience. We're all working through this together.
Exactly. There are some implicit messages in there that are really helpful for people of like, I'm not alone. I'm not the only one experiencing this. I'm not the only one crying or breathing heavy or having some sort of reaction, but it's also very confidential. Nobody's talking about their experience at all. It's all happening internally. So it's in a group, it's really individual EMDR in a group setting because you're not talking about your experience with the group. It's not like talk therapy or group therapy at all.
Which probably feels a lot safer for some people too. Like, okay, I know there's other people like me, but I don't have to retell my story. I don't have to talk to them. Yeah.
Yeah. But I also don't have to go through this alone either.
Yeah. That's so cool. And just
it's really
hearing all the different ways we can use EMDR to help people and just get back in touch with their bodies. Too.
Exactly. And what's also cool with the group protocol, I mean, when I've done it in refugee camps, for example, you're not in this like quiet, perfect little setting like the therapy room is. A lot of times we're in open air gymnasiums. There's like cars going by and honking and wind blowing. And one time there's like a lightning thunderstorm above us and a rainstorm happening. And there's goats and cows walking through and all this stuff. And people can still reprocess. It's amazing what people can do when they really focus in. And so that's one of the fun things about what we do is you can use these protocols in a traditional therapeutic environment of week-to-week therapy, or you can do intensives, or you can do group, or you can do this in refugee camps, or you can do it, after a natural or man-made disaster of some kind. I mean, there's just so much flexibility in which you can help people heal. And that's what we want to sort of help therapists that think outside of the box really access the ability to provide services to sort of a wider group of people and situations.
And I remember when I took the training too, I'm blanking on what exactly the mass event was that you were showing as an example, but I remember seeing pictures of even children. Like this isn't just for adults, just going to help children and teens who.
Yeah, it actually originated with children. Really? So Lucina Artigas, who is Dr. Nacho Herrera's wife, she's also an EMDR therapist and trainer. They live in Mexico City. And so I think it was about 20 years ago, they were EMDR basic trained, and they were responding to a hurricane on the coast of Mexico. And they were invited by the community to come. They're like, we want you to provide EMDR. So they arrived and they were like, how are we going to provide individual EMDR to people? Because there's hundreds of people here who need help. How do we select just a few people to help while we're here for a couple of days? So they sort of organically, Lucy sat down with a group of children because she's an expert in working with kids. Okay. And so she sat down on the ocean, the beach, sandy floor with a bunch of kids. We have these really old, adorable photos of them sitting, cross-legged. And she spontaneously she created the butterfly hug. She's the originator of the butterfly hug. So she's, initially she has them tapping on their legs, but then eventually she turned it into tapping on their chest. And she had them drawing pictures on the sand. So she had them, think about the hurricane and then draw a picture in the sand of what the hurricane was like. And now I want you to, give a sud with your fingers, and now do the butterfly hug as you think about that. And then they kind of erased the picture, and then they draw a new picture that came up. They did the sud, then they did the butterfly hug. And she did that over and over again. And then she realized pretty quickly the kids were like, oh, I feel fine. I want to go play. And so then they went to the store and they got crayons and paper, and then they, got a table, and then they adapted it over time into what it is today. And now I think they have over 30 research articles showing the effectiveness of this group protocol that they sort of organically created about 20 years ago. And then they've systematized it. So now it's a formal protocol. But yeah, that's how it started. And it started with children. So we have an adapted version for children and for adults.
That was really cool too. And I think also good for people to hear how this can be helpful for children as well too. Because I think some people, I know I'm getting into consulting too. And I've even seen that in some of the trainings where people are like, how would I even do this with kids? And I mean, kids are they're much more intuitive than we give them credit for. Like they're able to measure their own distress. Like they can let you know how they're feeling.
And you can get creative, like, a 10 is maybe an elephant and a 0 or 1 is like a mouse, and so you can create spectrums that are in children's language. that makes sense to them. And then there's also creative things you can do. Like, for example, there was this landslide in Colombia several years ago that killed a lot of people in this community. So these EMDR therapists came into the community and they were providing group EMDR over the course of 2 days for children, but they called it a circus. And so they were dressed up as clowns and they would play games with the kids. So they would do, 1 hour group EMDR set. And then they would play games for like an hour and they'd jump rope and do all this stuff and they're dressed up. And then they would do another set of EMDR. Then they'd have lunch. Then they play games and then they would do another set of EMDR. So it was kind of a fun way to get kids involved and coming and feeling safe and happy, but then also incorporating EMDR into it in a way that felt non-threatening and not like this sterile kind of therapeutic process, but was a really fun experience for the kids. We had some really fun photos from that of EMDR therapists with like clown noses on and big shoes and all this fun stuff. And they had a great time.
That's amazing. Because that's what I really found with kids is they're not going to want to sit in the yuck or talk about it. So it's getting creative ways to make it a little more engaging or more fun and make it feel safe. And
the fun thing about doing EMDR with kids, they process so quickly.
So fast. Because
they're, if you think about it, their memory network of experiences related to that incident are so few that there's not a lot there to reprocess. So sometimes the way I explain EMDR is like if you had a house with a lot of stuff in it and you needed to clean up the house, over time, the more stuff that's in it could become like a hoarder's house. It's like it's hard to move around. You can't really see anything else. It's really all consuming. It's stressful. And it takes a long time to clean up. But if you don't have a lot of stuff in there, then, you can clean it up really quickly. And so for kids, they just don't have a lot of stuff in there. So you can clean it up really quickly versus somebody who's had prolonged adverse experiences, developmental trauma, attachment trauma, all this stuff, and they're 60 years old. There's going to be a lot of stuff in that house. And so when they're trying to clean it up, if they haven't done a lot of work thus far, and then they come to you and they want to start cleaning up, you can absolutely do it, but it's just going to take a lot longer than it's going to take a 6-year-old. So having that expectation as a therapist and as the client is going to be really important.
Oh, totally. Totally. Well, I feel like, too, you've made a pretty good case as to why therapists should consider getting trained in EMDR, but I figured I'd just ask the question, why should therapists consider getting trained in EMDR?
Yeah, well, I'm clearly very biased. So I think everybody should get trained in EMDR, but, the way that I see it is that there are a ton of different ways to heal, and there are a ton of different really effective evidence-based interventions that help with trauma, anxiety, depression, and all sorts of symptoms. EMDR is just one of them. And so if you're looking for another modality to help with that area, you could get trained in prolonged exposure. You could get trained in CBT, DBT. There's a million acronyms of things that you could get trained in. But part of it is also going to be the preference of the therapist. So for example, CBT is very different than EMDR in the sense that CBT is all about your cognitions. You give homework to the clients, you're kind of connecting X, Y, and Z, and then you're trying to change X, Y, and Z. And it's very, very cognitive and it's very effective. And if the therapist is really into that kind of therapy, you want to enjoy the work that you're doing and the interventions that you're using. So if that appeals to you, or DBT or something else, then you should do that. If the idea of EMDR appeals to you for whatever reason, like for me, initially it appealed to me because I was like, oh, it helps with trauma. It's an evidence-based therapy. And you can do it in a group setting. And the way in which you do it in a group setting sounded interesting to me for the population that I worked with. And so I just did it, and I happened to love it when I was doing it, and then found my own EMDR therapist and went on my own EMDR journey. Because for me personally, I had done a lot of talk therapy and it was really useful for me, but there were a few areas that it just felt like I just never really made enough progress, never really released it. And then I did EMDR because with the training, you actually have to experience EMDR as a client in the basic training. And so when I was experiencing it, I was like, holy moly, this is crazy how quickly it's working, how effective it is. Like, it just blew my mind. So afterwards I was completely hooked, and then found my own EMDR therapist to keep doing that work, and really enjoyed that process. So for me, it just fit, and it's not a one size fits all. It's not going to be the end all be all for everybody. It might be some people become EMDR therapists like me, and that's what they do, and they don't do anything else. And then for other people, it's one of many things that they do, or maybe they do it and it's really not for them and they don't really use it, all of which is fine.
Yeah.
So I would just say, as the therapist, just kind of, ask yourself what type of therapy you want to do, what kind of interventions you want to use. If you feel fully equipped to provide services in certain areas, and if you don't, then seek out the training that would help with that. EMDR could be that training for you. And if you have questions about it, feel free to reach out or, talk to an EMDR therapist or reach out to us. We're always in our inbox answering questions to see if it would be a good fit for you. So I don't know. That's what I would tell people is just be honest with yourself about what you want. And maybe EMDR is right for you. Maybe it's not, but it's right for a lot of people, that enjoy using it.
Oh, totally. And I appreciate that too. Cause I'm definitely, it's funny. When I got the basic training, I didn't even actually, I thought it was all made, like, I just didn't believe in it.
Yeah, that happens to a lot of people.
And I remember I got it specifically because it was an opportunity to have a discounted training. And there was a group of people that I was working with. We were going to do it. And I was like, and everybody was saying like, well, this is a really good therapy. And I was feeling stuck with a lot of clients. Like, why not? I'll try it. And it wasn't until that first practice session, because during lecture, I was trying to have an open mind. I really was. Yeah. But I feel like it was
weird eye movement. Like, how does this
what is this?
It's a weird therapy.
It is. And then my eyes started moving and things started happening. And I was like, oh gosh, there's something to this.
Yes, it's crazy. Yeah. I mean, and so when we're in REM-like sleep state, our eyes move back and forth. Yeah. And so there is this theory behind EMDR that's like, well, when you're organically reprocessing a memory, is there something that's happening in the REM sleep state where it's actually organically reprocessing? We don't know for sure, but there is some theories behind that there's something to that. And then the working memory theory research is starting to come out that it's this concept of, when you have all these tabs open in your computer, eventually your computer is going to shut down if you open too many tabs. If you tax the working memory too much, eventually things need to start getting discarded because the brain can't physically, like biologically, it can't hold everything. So for example, if you're really activated and you're thinking about a memory and you're getting really anxious and your heart's racing and all this, and you start tapping and maybe you start humming a song and you're marching your feet and you're counting down backwards, if you're doing all these things at the same time, eventually the symptoms just subside because the brain can't do all of the things. It can't get overtaxed in that way without releasing some different areas. So more research is coming out about that to really understand that concept, but there's a lot of reasons why. So it's not just eye movement. That was just the original way in which we discovered that this has a positive effect on the brain. But I agree, it's a completely weird therapy. And a lot of people come into the basic training skeptical, which is completely fine and normal, and then you can just take the training and decide for yourself what you think at the end.
Oh, absolutely. Yeah. And hearing you talk too, even about that, the different types of DAS that are out there, BLS, DAS, tapping is becoming, I've noticed that too. There's more people coming in who have like, at least it's not EMDR, but I've heard of like different forms of tapping. And I feel like tapping is becoming more of a thing.
EFT and there's other types of therapy that use.
Yeah, there's like heart math, I think is another one. And there's even like I've seen these little wristbands for, mostly for youth who are neurodivergent, but they like they remind me of the EMDR buzzers where they just vibrate back and forth in a certain rhythm to help soothe their nervous system.
Yeah. Well, there's also theories behind just cultures over time that have been using organically bilateral movement in healing. So if you think about like drum circles, or even just like walking, or if you think about certain like churches that are really lively and they're clapping and they're like moving back and forth as they're, thinking about hard things in their life and then positive things. And, they're kind of in that state and they find that really healing. Like there's lots of ways that I think bilateral stimulation has been used in healing journeys just culturally over generations that, we haven't measured the results, but they have been used for healing. And I imagine that there's some component of that has EMDR-esque aspects to it in it,
Oh, totally. Yeah. I hadn't read his book yet, but when it kind of came, I don't know if you heard about this, when it came out that Carl Jung was actually a practicing shaman.
I didn't know that.
Yeah, that's come out recently. And I was listening to some tapes about it. And then like kind of, I work with some holistic healers that use drum. And I was thinking about what you said, like that is audio bilateral stimulation.
Mm-hmm.
You're sitting there, you focus, but that's where he got the concept of shadow work too, came from a lot of shamanism, working with the shadow self.
That makes sense.
That darker side of yourself. Yeah.
Yeah. I mean, there's just so many different ways to heal. And I've experienced some therapists over time that might have sort of this competitiveness to it that might challenge EMDR or this is better than this. And I'm just like, we're all here to just try to help people heal. And EMDR is just one of many different ways of experiencing healing. And it works really well for some people, and some people love it. Some clients love it. Some are like, whatever, or maybe they hate it. Who knows? And same with therapists. And so, just take it for what it is, but it does help people. We know that from the research and anecdotal stories, and it's going to fit for you or it's not. But let's just all kind of embrace that there are a lot of different ways to heal, and this is one way to heal.
So if you could talk a little bit, what does the basic training look like? So we talked about how there's a practice part, but what does it look like?
The basic training is pretty intense. It's usually 40 or 50 hours. I think it's 40 hours of lecture and 50 hours of consultation, 10 hours of consultation. So 50 hours total typically. So some trainers design it as 5 days. Some design it as 6 days. Usually if it's 5 or 6 days, it's like 2 or 3 days in a row of a combination of lecture and practicum. And then you have consultation groups in between the part 1 and the part 2, because you're supposed to be practicing with your clients throughout the training, and then talking to your consultant, asking questions about it. And then you come back for the part 2, where you're kind of stepping it up to the next level. And so it usually takes a few months to do the full part 1, part 2, plus the 10 hours of consultation to finish. It's pretty intense. Like I said, you're going to be using EMDR in the practicum as the therapist. You're also going to observe people using it. You're going to watch demonstrations, and then you're going to experience it yourself with a real life scenario. And so if that excites you or sounds great, maybe it's for you. If that sounds like, whoa, I really am not ready for that, I don't want to do that, which is okay. That happens to some people in the training where they get into it and they're like, I've got too much going on in my life. I can't, go there right now. Then maybe wait until you're in a good season of life to really commit to the process, because it's a very intense training. But you're going to walk away with your mind blown with a ton of great information in the end. Most of the trainings cost what I've seen between $1,000 up to $1,600. So it depends on the trainer. You can take it online, you can take it in person. I would go to the EMDRIA website, so EMDRIA.org, I believe. Yeah. That's where you can find a lot of the EMDR trainings in your area or online. Obviously, Scaling Up also offers training, so there's a variety of places you can get trained.
Yeah. And then you said, and you can do it on, and that's like a newer thing, I feel like, too, being online
Once
now.
COVID started.
Yeah.
Yep. It actually was not online at all before COVID. It was only taught in person. And then after COVID hit, it was all taught online. And so now there's a combination of options available.
And that's something too that's newer too, the idea of even doing EMDR online, which I know, like, I'll have clients call me and, they'll be like in a different part of Colorado and be like, well, I don't know how to do this, but somebody recommended I call you for EMDR. And so my understanding is from the research, it seems like the same level of effectiveness. Is that your understanding? Or
there hasn't been a ton of research yet, because we really just started researching it during the pandemic. When we were forced to go online. It was, I think some people believed it wasn't possible, or, we were able to do it online, then we had to do it online. They realized you can do it online. So we know that we can. We've been doing it for years at this point, but the research is newer. But so far, the research is showing it's just as effective and safe.
Awesome.
Yeah, you just need to make some adaptations, obviously.
Yeah. Yeah.
To, just like we all did during COVID for online therapy.
Oh yeah. Yeah. I have this. They must have created it for the pandemic. It's called Easy EMDR. It's like a little ball that goes on the computer screen that I can share.
Programs like that. Yeah. When I was doing EMDR online, I just used the butterfly hug with people. But yeah, there's a lot of programs online that you can use that I've heard are really great.
Awesome.
Yeah.
So, and then after the basic training, I know that was part of my journey. I did the basic training and I actually I used it for a little bit, but then felt like I did need a little bit more. So that's where I know the advanced trainings, then my journey to get certified just kind of made sense.
Yes. So just like a lot of trainings, the way that EMDR works is you get basic trained. At the end of those 50 hours, you're just trained, and you can use EMDR with clients, and you can stay that way however long you want. I recommend that you get certified afterwards if you're using it regularly, because once you start using it with clients, you realize there's a lot of different ways to conceptualize their cases, or how do I target certain things? What is my strategy here? What if they dissociate? What if they have developmental trauma? There's just a lot of questions that come up. So the certification process is you have to be licensed to get certified. You have to use EMDR a certain number of times with a certain number of clients. I forget the exact number. I think it's like 50 hours of EMDR with 20 clients or something.
That sounds right. Something like that. Yeah.
And then you have to get 20 consultation hours with your consultant, who's typically watching videos of you providing EMDR and offering helpful feedback. And then you have to take a certain number of advanced trainings to, you could take nachos training, an intensive training, a refresher course, attachment, EMDR, dissociation. There's all these different EMDR with kids, all these different kind of specialty areas that you can take, some of which are with Scaling Up. And then, lots of other therapists provide advanced EMDR trainings on different topics. So you have to take that, and then you have to send in some letters. It's usually minimum 1 year, usually about a 2-year process to get certified. So then if you're certified, if you want to become a consultant after that, then you can do a process to become a consultant, and then after consultant is trainer. So if you're really dedicated to EMDR, you can kind of climb that ladder, or you can just get trained or certified. But you will feel the most confident and competent, I think, if you get certified, if you're using it regularly with clients. And I think it's a fun process.
I agree. I felt way more confident once I started getting more advanced training in it. And I do think it's fun. You get to meet cool people, like-minded. You get to learn all these different techniques, ways to think about things. It's
kind of like being back in supervision a little bit, except it's EMDR focused, and it provides, you're just learning from other people. You can do them in group settings, which I think is fun, because then you're learning about situations other people have been in that you haven't experienced, but you might experience it. So now you've kind of learned what that person experienced, and then what the consultant recommends doing in that situation. So and you're networking with other colleagues and stuff. So I highly recommend getting certified after you finish the training. I am curious for you, James, you said you went in skeptical and then it's shifted. What was that shifting process like for you, and how long did it take?
Oh yeah, no, that's a good question too. I mean, my shift happened, during the training. It was when, I want to say it was the first day when we made Safe Place. As it, and it was actually feeling, for me specifically, what happened was I felt these tingly body sensations kind of going from my stomach up to my chest, and I felt things relax, and I felt muscles relaxing.
Yes.
And then I remember, which I will say this to all therapists, do the best you can to make it something that's not going to be too deep, but we do the best we can. Mine was at the time, I was just licensed, and I was working with parents and kids, and I don't have kids myself. So I was feeling really unconfident. So I went with specifically a situation where a parent was just questioning a lot of what I was doing. And it was fascinating. It opened up stuff about, I noticed a lot of stuff around my parents came up, my dad came up, and I'll never forget this. There was a shooting pain in my neck that kept coming up. And and it was stuck. And so the trainer came up and said, well, just focus on that pain and maybe even stand up and stretch a little first, and then focus on that pain. And then I realized it was my ex. Literally a pain in my neck. And like that
This is basic training, or
this
were you the demonstration person for Nacho in the Denver?
I think I was. Yes.
I think you were. I remember that very vaguely, but I think it was you.
Yeah, this happened in the basic training. I think it may have happened again too, because I hadn't fully processed it. Like that had been like in the basic training. That's actually what sparked me to go into therapy, but I went to talk therapy.
Interesting. Yes,
yeah,
I remember this.
And it connected to
you
being
body. I remember you had body sensations like around your neck area. This was
Yep.
in that 2017. Yep. Yeah.
And I burp a lot too whenever I do EMDR.
Yeah.
But yeah, neck stuff too. So I think what I've learned since then is I hold a lot of tension in my neck and a lot of stress. And especially when I'm feeling anxious or like that imposter syndrome's coming up, I tense up, like, well, people can't really see what I'm touching, but like my shoulders and my neck, I've noticed that now that I have this more of a body awareness.
It's a somatic reaction to your emotional experience at this point.
Yeah. And so and that's the other cool thing about EMDR, how it just gets to the body more than I think other therapies can.
I agree. Yeah. Because as we know, the body keeps the score. We store our trauma in our bodies. And so you're always looking at your body to find that movement with the bilateral stimulation to release it. So your body doesn't have to hold it anymore.
And yeah, that was the shift. And then the basic training, the reason I kind of took a step back from it, honestly, was more financial than anything. I was working mostly with kids. I knew I needed more training.
Yeah.
And I just didn't have the funds at the time. So once I came into it, that's when I jumped back in. I started getting more advanced trainings.
Yeah. Well, and I'm glad that you brought that up because, that is an issue, which is why we provide scholarship opportunities at Scaling Up to try to make it more affordable. But also, one thing that I think is really important to keep in mind is if you want to become an EMDR therapist, a lot of people will refer to you. If you have a private practice, for example, and you're trying to get referrals in, if you say, I'm an EMDR therapist, I do EMDR with clients will find you because they want EMDR. Therapists will refer to you because their clients want EMDR or they want their client to experience EMDR. And so if you're on the EMDRIA website, if you're on Psychology Today or anything like that, and you're saying, I'm EMDR trained, it will not take long for you to start getting those referrals in specifically for EMDR therapy, which can also help then pay back your investment pretty quickly. If you think about all you need is really one or two clients to come to you for EMDR for a couple of sessions, then all of a sudden you've paid that training back. So if you're able to kind of make that initial investment, even though it might feel a little bit scary and really expensive because it is, knowing that training will pay for itself in the long run. Same with the certification process. That can be really helpful.
And I totally agree with that because once I got more of those advanced trainings and I felt like I knew what I was doing and I really felt comfortable identifying myself as an EMDR therapist, people just came and and it did. It paid it back.
Yeah. And the other thing that we do at Scaling Up is we also have a lot of groups that will take the training together. So if you have a group of people join us, we give you a lower rate. So we'll oftentimes have like an agency that will send 10 people or a group practice that will send their whole group practice to us and get that discount. We've even had some people will pull together a group of like 10 friends and then they'll all save money in their process because they'll sign up as a group. So that's one way that you can save money, at least with Scaling Up. I don't know if other training programs do that, but if you are in that situation or could get a group together, that's a great way to save money on the training.
That's really good to know.
Yeah.
Last question for you is, so if a person is interested in receiving EMDR therapy, what are some things people can look for in an EMDR therapist?
Oh, great question. So one, if you go to the EMDRIA website, you can find clinicians there. I recommend finding a clinician that's certified as a consultant or a trainer status, because then you know that they're skilled at it. If they are not certified and you don't know them, it's hard to know where they trained 2 years ago and they just use EMDR from time to time. Because I have had some people just say they've had a bad EMDR experience, and it makes me wonder who trained them, and how how are they using it correctly? Because we know that if you're using it correctly, it's effective. And so that usually makes me wonder kind of who was your EMDR therapist and were they doing it properly? So I would look for that first. And then also, if they have the competency there, which is what the certification process will offer them, then I would just say the second thing to really look for is, do you have that rapport, that comfortable connection with a therapist? Because a therapist isn't a one size fits all situation. So I usually recommend to people, if you're really looking for a therapist, I recommend finding like 3 therapists, meeting with all of them. Hopefully at least one of them is a good fit for you. And then letting them know when you first meet with them, like, hey, I'm actually meeting with a couple different therapists. I want to see who's a right fit. The therapist will do their whole intake process. You can sort of get a feel for them and then decide which one you want to go with. If the therapist is not cool with that, then that might be kind of a red flag, I think, that they're sort of taking it personally when it's not about them. But if they are cool with it, then you get the opportunity to sort of pick who's the best fit for you. Because sadly, I think what happens a lot is people, they take a long time. They finally find a therapist. The therapist takes a while to call them back. Then they have to set up a call. Then they're on a wait list. And then a few months later, they're finally in, but they don't really like the therapist that much, or it's not a good fit for them. Yeah. But they spent months trying to get connected to that person. And so they kind of feel like, well, unless I'm going to start all over again, I should just stay with this person. And it's kind of a laborious process, unfortunately. Yeah. And so I think if you kind of start right out of the gate with like 3+ people that you're going with, then eventually once you go through that whole process, you can release the ones that aren't a good fit. And hopefully one of them is a good fit. And then you're not starting over again. So when I'm looking for a therapist, that's the process that I do. And I recommend people do something similar so that it doesn't feel so tedious and laborious and kind of deflating if they went through all of that and that person's not the best fit for them.
Totally. I like that suggestion too. And really emphasizing that importance about you have to trust your therapist. You have to feel safe with them. And EMDR it's no different. I know a lot of people will come to me thinking, well, I try to explain too, there is less talking in EMDR, but it isn't like a completely like mute or silent treatment. And that level of intensity, I've told people, because some people will be like, well, let's just get going. And I'm like, well, I'm going to have you go to some really, really uncomfortable places.
Right.
And so having safety and trust here is going to be important, because even though we may not be talking as much, that pit in the stomach that I'm crawling out of my skin feeling that can come up, like,
yeah,
I want to be a grounding force for you.
Right. Exactly. And when they're like, is this normal? Am I okay? Like they're trusting you in that moment. And if they don't trust you or feel comfortable with you, and therapists are people, we have kind of vibes that we give out. We have different personalities and senses of humor and stuff that are going to jive with a lot of people, but not everybody. And so you really do need to find somebody that is just a good match for you. And that's just not going to be every therapist. That's normal, and I'll tell clients that work with me. I'm like, hey, if I'm not a good fit for you, that's fine. I don't take that personally. That's normal. I'm happy to help you find somebody that is a good fit for you. Just let me know, or don't come back, whatever works for you. That's fine. That's totally normal. I'm not going to be everybody's cup of tea. I'm very direct with clients. I'm very direct when I'm teaching people. And that is completely some people's preference and not other people's preferences. And I just know that about myself, and that's fine. So really be honest with yourself and with your therapist about what a good fit might look like for you.
Very, very important. And just really good permission to give people, like, and just, I think I like how you said too, it's a very tedious process. And so people will feel kind of stuck with somebody because at least they're talking to somebody. So I like that. Yeah. Have a few people, try them out, and normalize it's okay to say this isn't working. And also for therapists too. It's okay for therapists to say it may not be the best fit.
Absolutely. I think it's really important that therapists do that, especially if you're kind of outside of your realm of what you're an expert in. For me with intensives, again, it's more supplemental therapy. So if somebody wants to see me ongoing, or they have issues where they really need more ongoing therapy instead of like a 2-day, now you're done, that's not going to be the right fit for me.
Yeah.
because that's not what I offer to people. So I try to be really honest about that. And in the medical field, people get second opinions all the time. Why
Yeah.
don't we do that with the therapy world? You know,
That's a really good point. I've never actually thought about that. But that's a really good point. Yeah. Why wouldn't we
why wouldn't we?
get a
It's
second
just
opinion?
natural. It makes sense. If you want, and again, in the medical field, we have specialty areas,
Yeah.
if you want to do heart, if you want to do brain, whatever. In the therapy field, I think we're starting to do that more. Like I focus on eating disorders, I focus on addictions, I focus on PTSD, something like that. But go to an expert in your area. If you want somatic work, go with somebody that does somatic work. If you want EMDR, go with that. If you want CPT, I mean, these are really different types of interventions and treatments. So find what it is that you need with the type of therapist, just like you would want to have some level of rapport with your doctor. You need to have a level of rapport and trust with your therapist. So I don't think it's any different. Go get a second opinion. If something doesn't feel right, trust your instincts.
Yeah.
Go get a second opinion from another therapist.
Absolutely. And that trusting your instincts, like, I don't know, just we have as a species have gotten so far away from that, which is also why I like EMDR. It does make you start to tune in more to your body and your natural instincts.
Yeah, in the US, we're very independent and we're very
Yeah.
cognitive.
Yeah.
And so EMDR sinks you more into your intuition and your body, which is very normal in like Latin American culture,
Yeah.
but not as typical in US culture. So I do think those dynamics can be very culturally influenced as well, but we need more of that in the US for sure.
Okay. Well, Clay, how can people get a hold of you if they wanna reach out to you?
Yeah, so our website is scalingupemdr.com, and you can just contact us through the website. We've got a great team. Meredith and Robin on our team are typically the ones in the inbox. We also have Facebook groups. We have 3 different Facebook groups that you can join. EMDR Intensives Facebook group. We have Scaling Up Mental Health Access Facebook group, and then we also have EMDR for Early Intervention and Ongoing Traumatic Stress Facebook group. So you can join any of those communities for free. And get connected that way.
Awesome. Thank you so much for being here and sharing your knowledge. This was so awesome. This is really good.
You're welcome. Thanks for having me. I love geeking out over this stuff, and I could talk about EMDR all day. So I'm happy to be on here and hope that people find it useful and reach out.
Absolutely. Yeah. Would love to have you back on again.
Yeah, would love it. Thanks so much.
Another big thank you to Kelly Smyth-Dent for taking the time to sit down with me and teach us about EMDR and her work and all of the creative ways that EMDR can be used to heal all forms of trauma, no matter the age of the person. I actually have used scalingupemdr.com as a resource before. There's just a wealth of information, so I'd highly recommend it for anybody, whether you're an EMDR clinician or interested in becoming an EMDR clinician, or somebody who's interested in receiving EMDR as a treatment. I will be fortunate enough to be co-facilitating a basic training that Scaling Up is hosting next week, and I'll be providing consultation for this new cohort of EMDR clinicians. So I'm very excited about that. And like Kelly was saying too in the episode, if you are interested in learning more about EMDR, there's the scalingupemdr.com website. There's the different Facebook communities that she mentioned, and then you can also go to emdria.org, emdria.org, to find an EMDR therapist and to learn more about EMDR therapy. And if you're a EMDR therapist and you join that website, you'll also have access to journal articles and latest research and just a lot of really helpful information. Well, I hope today was helpful. Please join me next week where I'm going to be talking about how attachment can impact our relationship with our emotions and how that can sometimes keep us stuck or make it really hard to work through emotions. Have a great week and take care.